Welcome to Southwest Florida Frontline, the platform where America's first responders, last responders, and military personnel share their stories. This is your platform to share your story, inspire others, and be heard. The views, experiences, and opinions expressed in this podcast are those of the individual speakers and do not represent the official stance of any affiliated organizations or entities. The information is for general informational purposes only and should not be taken as professional advice. We are committed to maintaining the privacy and confidentiality of all guest speakers and participants and adhere to the highest standards of ethical conduct.
Our guest today is Dr. Thomas Coyne, Chief Medical Examiner of District 2 in Tallahassee, Florida.
Southwest Florida Frontline, live from the Sunshine State.
Welcome to our podcast, Tom. Thank you very much for being here.
Well, thank you for having me.
It is a pleasure having you as the first guest for the first episode ever. So that is, it's very amazing. And I mean, I'm very happy about that.
Oh, I'm honored. So thank you.
No, I am honored. Thank you very much. Can you perhaps, give a brief introduction on what exactly you are doing for work?
Sure. Well, right now I am the current Chief Medical Examiner of the District 2 Medical Examiner's Office here in Tallahassee, Florida. Florida is about 25 medical examiner districts. Our district covers 10 counties here in the Big Bend area of Florida. And I'm the chief and only medical examiner here for this district.
And do you remember, was there like a specific moment or that you remember that brought you into that specific field?
Forensics in general, or?
Yeah, or forensic pathology?
Yeah. Well, it's a little different. I have a lot of colleagues who grew up, loving true crime stories and those movies and books, and knew from the start that they wanted to go into forensic pathology. And that couldn't be further from the truth for me. I come from a blue collar background. Everyone in my family is in construction work. No one ever went to college. I was always a little more geeky than my relatives, and so I thought about college, but didn't think that I could go because no one else in my family had ever gone to college. So when I finally made the decision, I started out into community college. I knew I wanted to try to pursue medicine because I always thought that was a career that I kind of had on a pedestal. I had a lot of, health problems growing up, like asthma, allergies. I had to get multiple ear surgeries. And so I always really respected my doctors and thought that would be a great career path. So anyway, when I went through college and I was getting ready to graduate my undergraduate, I wasn't sure where I was going to go because I still at that point did not think that I could become an MD, right? I just didn't have the confidence in myself. So I took a year off of college and I started working in a lab at Rutgers, where I went to my undergraduate, Rutgers University. And it was a neuroscience lab, the biobehavioral neuroscience department. And I was doing work looking at animal models of Alzheimer's disease, trying to have a better understanding of learning and memory, and figuring out ways we could pharmacologically improve one's cognition, especially if you have, neurodegenerative disease. And I was there for a year, and I decided, I'm going to go to grad school. That's probably the best thing for me. So I entered into a PhD program. And I couldn't get into the neuroscience program at Rutgers because they wouldn't take their own students. In other words, they had a policy where if you graduated Rutgers undergraduate, we weren't going to accept you into our graduate program. We always wanted outside persons. And so to continue working with my current professor, I had to enter into the toxicology program because he was also an adjunct faculty member of toxicology. So I first started out thinking, hey, I'm going to be a PhD toxicologist and I'm going to study brain toxicology. And my research was transplanting stem cells into the brain. We were collaborating with a lab at Rutgers University using bone marrow stem cells, and we're transplanting that into the brain, animal models of Parkinson's, spinal cord injury, Alzheimer's, the goal of which was to, improve function in those animals. And while I was doing that, I realized, I said, if I just did the research part, I'd never be able to treat patients, right? I'd be stuck here at the bench, never be able to go to bedside. And I had gone to a conference one of those years to the American Society for Neurotransplantation and Repair. And I was around always neurosurgeons, and Michael J. Fox was actually a guest speaker there early on when just after he had his first diagnosis of Parkinson's. And I said, I want to be a surgeon. I want to be a doctor. And so I changed my plans. I talked to my advisor, my mentor, and I said, I want to get into the MD PhD program. I was already in the PhD program. So I applied for medical school when I got into the MD PhD program. And that's a 7-year program on paper, right? But it took me 9 years because I had started my PhD first. I was very involved in research. And also during the course of my PhD year, 2 of my mentors died suddenly. So that kind of sidetracked me a little bit. So anyway, I finally get into the medical school side of things. And I was so sure I was going to be a surgeon. But like I said, that's 9-year process, or at that time it was around 7 years. And although my academic world was moving very slowly, my personal life was moving a little faster. So I had gotten married and we had our first child. And it was during my 3rd year in medical school. I was in my finally got to my surgical rotation, started out in neurosurgery. I was all excited. And I realized, wow, if I continue this pathway, I'm never going to see my wife and kids again. You know, I'm going to be married to the hospital. And it was funny. I was in the surgery with an older guy, about 65. He was near retirement. And I remember him telling me, we were talking about our lives. And I said, I had a 3-month-old son at home. And he had told me that, you know, he spends a lot of time now with his grandkids because he never had the opportunity to spend time with his own children. And I was like, nope, that's not going to be me. And a few weeks go by, I'm still in that rotation. I'm kind of lost now because I'm like, I can't do neurosurgery. And I had to run a specimen. We were doing a surgery. It was one of the pediatric neurosurgeons. And she was removing a tumor from the back of a child's head. And she asked me if I would run a specimen down to pathology because she wanted to get a frozen diagnosis. Because, surgeons very often use pathology for those reasons. In other words, they know there's a tumor there, or they're not quite sure, is it a tumor? Is it an infectious process? Let me send a piece off the pathology. The pathologist will, of course, freeze that tissue, cut it real quick, stain it, look at it under the microscope, and call back to the OR and say, yes, you have lesional tissue. Yes, this is a tumor. So in this case, I grabbed the specimen, I ran it down to pathology. And once I walked in the pathology, department into the gross room, I felt at home, right? The sights, the smells, the smell of the xylene, the staining bath, because for the past 10 years, I had been doing research and I was working in a very similar laboratory. I would do all my my animal surgeries. I would do all my animal autopsies or necropsies. I would do my own histology, my own staining. And so I just felt at home. And I realized, wow, I can continue on as a physician, still being involved in patient care, but having more of a back scene approach, whereas I didn't necessarily have to be the on-call surgeon, missing out on my family's life. So that got me into pathology. And then when I got into pathology, I assumed, well, I mean, I'm a brain geek, right? I spent all 10 years doing research on animal models of injury, spinal cord injury, brain injury. I have to go into neuropathology. So I originally thought it was going to be general pathology and then neuropathology. But all pathologists or all pathology residents will rotate through a medical examiner's office as a part of our general rotations, because you're required to get 50 autopsies during your residency. And many residents never get that number. So they have to go to a medical examiner's office to increase their autopsy numbers. So I had that opportunity. And again, once I went there, I fell in love with it. I didn't know that I would. It was super exciting. I'll say, the thing about pathology, autopsy pathology, that I loved is that you have to know everything, right? I mean, because, you're not going into an autopsy as a person who just has a specialty in the heart or especially in the GI tract, right? You have to be aware of everything, how everything is interrelated, have a good background fund of knowledge in pathophysiology to be able to work through all of your differential diagnoses and arrive at what what killed your person. And forensics was, like, to me, even more exciting because you didn't know what you were getting on any given day. It could be a natural death, or this person could be a traumatic illness, or it could be, one of my first cases there was a person who was suspected to be a natural death and turned out to be a possible homicide. It was just completely blew my mind. And then the other thing is, me being a person who grew up doing construction my whole life, using my hands, wanting to go into surgery, well, I still have the opportunity to do that, right? So on all of my autopsy patients, I was a surgeon, and I really liked that aspect of it. So at that point in time, I realized I have to somehow be involved in forensics. That got me on the pathway of forensics. So the great thing about it is, after I finish all my training, so right now I'm board certified in general pathology or anatomic pathology, neuropathology, and forensics, but I also have a PhD in toxicology. That wasn't my plan from the start, but it really works beautifully together to help me with all of my cases I have now, because so many of our cases are drug related or tox related. So many of our deaths are the result of brain or head trauma, as well as natural death. So I didn't realize that I was preparing myself for the role of forensic pathologist the whole time, but it worked out perfectly. So yeah, and now that I've been doing this for a little more than 10 years, I wouldn't have changed a thing. I'm completely satisfied with my career. Yeah, really love it.
You said something very interesting, actually, in a side sentence, but I feel like, to me, this is the core of who you are. As, the person who I know, and you said that you basically chose a different career path because you put your family over your career.
Yes.
And I think this is, to me, someone who has his priorities right. And this shows me that you care. And I feel like in this specific job, you have to care, even though your patient is dead. So that to me was very impressive. And then you also said that you are from a blue collar family, hardworking people. You are the first person going to college. And I can relate to that because I was also the first person going to college. My family is blue collar coal miners. And I'm coming to my question because, I was just wondering, knowing how hard it is to do a PhD, financing this by yourself, not having a role model at home that can help you, but still, I sometimes felt like out of place. I didn't really belong to my peers at the university, but I also became a different person than my blue collar family. So I was sometimes struggling to manage that and to not feel like an alien at home or at the new home that I created at the university. And I mean, you even have like 2 doctor titles. That is very impressive.
Yeah. Well, thank you for that. I think for me, I felt much more comfortable at home than I did actually in the laboratory or in the hospital, because my inner circle were all other individuals who weren't physicians or doctors or researchers. I felt more comfortable in that environment. I consider myself a layperson, and I think that actually made me a better physician down the road, because I would go home and I would have to explain to family members or friends what I did or what I do on a daily basis, and explain it in a way that they would understand without having a background in science. And I think it made me better as a physician, because whether I was in medical school or even now talking to families and trying to explain a very difficult concept, as to the genetics of why their loved one died, to be able to explain it in a way that a layperson can understand, it made me a much better physician.
Sorry for interrupting you, but I also believe that is why you are such an amazing teacher.
Oh, thank you.
So
yeah, I think, I've always been very good at being able to take a difficult concept and make it seem easier, because I have to do that myself at times when I'm trying to learn something. And so it's easy for me to convey that to somebody else as well. And I think that element of my background has made me, in my opinion, a much better doctor and made this a more enjoyable career. But one of the other things that attracted me to forensics was because my time wasn't being spent in an academic environment around other MDs or PhDs. Most of the people I surround myself with are those who are either investigators who do not have the advanced degree, or just general persons, or even law enforcement personnel. So I get along very well with them. And so the transition to the ME world was even easier because of that.
Mm. But did it ever cross your mind, what if I fail? I mean, knowing that you might not have like a safety net or anything like other people have.
Oh yeah, sure. I knew from the beginning. I think from the beginning, what propelled me was fear of failure more than anything else, because I saw my parents struggle living bill to bill. I knew how hard it was for them to provide for me, and ultimately, going back to what I said before about my family first, I knew before I wanted to be a doctor, I wanted to be a father, right? I wanted to be a husband and father and take care of my family. So I knew I had to work hard no matter what to have a position or a job that would allow me to support that family. So I went into my undergraduate years with that mentality, and I didn't cut myself off from friends. I still had fun. I still went out and did things, but I really I studied so truly hard, knowing full well that I had to succeed. There wasn't any room for failure, and I think that mentality, that fear of failure, is what kept me going even through my hardest times. And also knowing that my family didn't have much. It was very hard for me to get a scholarship, academic scholarship. So I had a 4.0 for my first 2 years of college. And I still had a hard time finding a scholarship to get to a 4-year school. And I ended up through like the International Honor Society, the 2-year school, I found an essay contest. I wrote an essay. I won, actually. And that gave me a full tuition scholarship to go to Rutgers. And so I didn't have all of this. I wasn't accumulating debt because I started out at a community college, low cost. I won a scholarship from my 4-year school, so I knew that I wasn't going to be a burden to my family. So even if I did fail, I wasn't going to be stuck with a lot of school debt. And I knew that ultimately I could fall back on my manual skill set, work construction, because I've been working construction since I was like 6, going to the job with my dad. I was very comfortable around tools. So I figured, well, worst case scenario, if this fails, I'm still young enough where I can jump back into that world. And thankfully, I never had to. I continued to push myself, and it became even easier when I was married and my son was born, because now I couldn't fail, right? You know what I mean? So I was doing everything for somebody else, and that somehow made it easier for me. When I was tired and I wanted to quit, nope, I kept going. And so yeah, and now I can relax finally.
Do you think, now that you mentioned your dad, I know your dad is also a Vietnam veteran.
Yeah.
The two of you have an amazing relationship. Do you think that was also the person who formed you into the father that you are today? Because I mean, every time you talk about your family, and it's clear to everyone who listens that this is priority in your life, and you enjoy being a father, and you want to be a good father. Do you think
Sure.
that came from seeing your dad being, or your
Yeah, I think both my mom and my dad, right? I mean, so I had my father, typical male, he was drafted, to Vietnam at a really young age. He was 18, was drafted and went off. He was in the, the infantry, and he was in recon. So he for a little more than a year of his life, would sort of be off in the jungle for a 3-month stint at a time with him and his small platoon. And I know he had seen and did a lot of things that adversely affected him, sort of caused him, I think, to sort of not really become reclusive, but more or less keep his emotions in check and on the inside. So he wasn't always like this outwardly loving guy. My mom was like, I get that side of me from her. But his work ethic, I still remember, as a kid, the thing he would say to me when I would complain about, having to do chores or whatever, or if he left me a list of things I had to do during the summer and I would complain about it. And I remember him saying, oh yeah, when I was your age, they put a rifle in my hand and dropped me off in the jungle. And you know what? He was right. I mean, I had it good. I had it really good. So his work ethic, he was always working 2 jobs, multiple jobs, for the family. That really served as a role model for me, for what it takes to support your family. And so whenever I was tired and didn't want to go forward, I would think of him and what he had to go through. And it certainly was a source of strength for me. And so, yeah, he was a great role model for me in that regards.
And you said that you have this inner drive that keeps you going no matter how hard the challenge and how
Yeah.
exhausting. Is this maybe also what keeps you going in your current job? Because I know from my own experience, it can be very draining. It can be
Sure.
very mentally and emotionally challenging. So how do you deal with that in your current job?
Well, I think, when you have people who depend upon you, it keeps you going, right? I mean, there's never been a time when I ever wanted to quit or give up. I think I'm too stubborn for that. I really do love what I do, and I have a sense of duty. I feel a true sense of duty and responsibility for all of the families of the patients who come through my door, right? I'm tasked with trying, at their worst time in their life, the sudden, unexpected death of their loved one, I'm trying to find a way to give them the closure they need to figure out what caused their loved one to die on that day. In some cases, maybe I'll find an underlying illness that could also preserve life in other relatives or siblings, or I'll bring justice to someone who's been wronged. So I feel that sense of duty that keeps me going at times when I'm really tired, but also just my responsibility to my family and now, of course, my staff. Right, so it's my business here. Excuse me, I'm the one in charge. I know that their lives depend upon us staying operational. So all of these things come together and keep me going. When I am at my most tired and I just want to give up. It's the fact that I have these people here, but more importantly, not to go off on a tangent, but you surround yourself with your inner circle, your people who you are in the trenches with. And those are the people that even when you want to give up, they won't let you, right? They're there to support you. And thankfully, I have a great group of people all around me who are there for that reason. They support me. They keep me from falling down when I want to.
Yeah, this is so important.
Yeah.
And I remember that you started your career as a forensic pathologist, or your first job in that career in Miami. Is that correct?
Yeah, that's where I did my fellowship, actually. So my fellowship training was at the Miami-Dade Medical Examiner's Department. I was there 2013 and 2014.
That means at that time you already had your son, correct? While doing night
Yeah.
shifts and weekend shifts and...
Yeah, I had both boys, actually.
Oh, wow.
We moved down to Florida from New Jersey when my youngest was 9 months old. And so, I started that fellowship training at that time when my oldest was just a little more than 5 and my youngest was 9 months. Yeah.
So how did you survive that, having two little ones at home?
Well, I tell you,
keep you up too.
I say, going back to when I first started the conversation was during my surgical rotation when I was in medical school was when Tommy was born, or he was 3 months old, actually, my first. And I remember he would get up 2 o'clock in the morning, 3 o'clock in the morning, and I'd have to get up at 4:30 to be at work. And I just remember never sleeping, and you come home exhausted and you just want to pass out, or I have to study for exams, and, he would be there, needing my attention. And so you'll learn a lot what you're capable of, in those moments. But then, so you carry that forward. So by the time I got to my fellowship training, it was much easier now. They were older. My youngest was 9 months old. So, he was sleeping through the night. So it was a little bit easier, but challenging at the same time, because I was always aware of the fact that they didn't know why I had to leave in the middle of the night. They didn't know why I couldn't be there for them. So I always tried my hardest to make sure, no matter what, I got back home to them and I was somehow involved in their lives, hands-on. And I've always been a hands-on dad.
But that also means that you could leave work in those cases, the trauma, everything you experienced at work when you came home? Or did you sometimes bring that home with you?
Oh, yeah. Listen, it's hard not to. I think in this line of work, you have to learn how to turn your emotions off, right? I always say to students who come in, and if you're working with us in the back, and we can have a room full of bodies, and people come in and they'll hear us joking or saying things that are off color, and they may think that we're careless or we don't care about them. And I always tell the new student who walks in, like, you have to understand the world in which we live, right? if every day I came in and I thought about every case and the grieving family behind them, or who this person was to their sister or brother or mother, father, whatever, it would destroy you. You wouldn't be able to carry on. You have to be able to turn that off and focus on the task at hand. The real problem is turning it back on when you go home and allowing those emotions to be reopened again for your loved ones. And that's the hard balance. That's the thing I've always found that was hard to do, because, I would have loved ones, and across time, you lose relatives or loved ones or friends. And in those moments, it was hard for me actually to find how to deal with grief, because I was so good at turning it off to do my job. That's, I think, the hard part about it. Because I've, when you go in there, you'll have cases that where a person may look just like your son or daughter or mother or father or loved one. And it's hard for your brain to turn that off and not think about what actually happened with this patient. It's a difficult part of our job, a stressful part of our job. I think that causes burnout more than anything else. Not so much the case volume, but the emotional aspect of it.
And does this help you to understand your dad better, who came back guarded from, all those terrible things he experienced in Vietnam?
Yeah, sure.
Because it's kind of the same mechanism, right? I mean, you have to
off
and on, and sometimes people have a hard time turning it on again.
Oh, sure. I mean, it's funny, my perspective of life and death is so different than someone outside of my career, And if I were walking on the street and came upon a dead person, I wouldn't have an emotional reaction to it. I think about it from a clinical perspective. I would be trying to gather evidence. I would be thinking about all this going on. Whereas I think life and death to others has a much more, emotional impact, and so my father, I knew early on that he, a lot of my family have a background in alcoholism. And I think in men, that's a great coping mechanism, right? They tend not to seek out, therapy, whereas they will just retreat into their own little quiet space. They will self-medicate, and that's how they deal with their pain. And I saw that a lot in my father growing up. And it taught me a lot about who I didn't want to be like in that regard. And so when I got into this profession, I knew, and how can you not, when you first start seeing cases and the volume of cases, you see a lot of horrible things. I mean, you go to your first homicide scene and you really are hit with the reality of what persons can do to other individuals, right?
Or themselves, too.
Or themselves too. And so, I think it's important for you to compartmentalize that and keep it separate from your other self, your non, medical examiner self. And thankfully, I've been able to do that.
I kind of feel like that this job or this line of work has been teaching me to live in the present moment, because I feel like this is all we have. It can be over in a heartbeat. And
Sure.
If I don't enjoy my life fully and I get lost in the trauma that I see at work, it's,
I think you definitely take things, it's very easy to take life for granted, especially, we're so busy. So we're always so caught in the moment, right? We have to get done with X today. I have these deadlines before the end of the week. And stark reminders of the fact that you only live once, and life is so, over in a blink, as are the cases I see here every day. You have many examples of persons who step out of their house, hop into their vehicle on their way to work, and don't make it home that night. So you try to, on those days when I have those reminders, and every now and then, I mean, again, like I said, I operate where I tuck those emotions deep down, but every now and then there are those cases that kind of bring me back to reality. And those are the nights when I come home and I give my kids a little bigger, a tighter squeeze, and I try to enjoy the moment,
Yeah, you just shared earlier with me that you had 55 autopsies yourself this month, I believe.
Yeah.
I mean, this is just the tip of the iceberg, right? There's so many other deaths you have to deal with that are, either natural death and only called in via phone call
Yeah.
or. So what do you say is an average work day for you? How many deaths do you experience actually per day, or are exposed to?
It's a little different. I'd say right now, because I'm a solo practitioner. So since I've been here in Tallahassee, and actually last year in Gainesville, I'm in District 2, Florida currently right now. A year prior, I spent 18 months in Gainesville, Florida, which is District 8. And I was also a solo practitioner, meaning I was the only medical examiner for that office. And so, during my time in Gainesville, about 18 months, or the 1 year, at least my last year, probably more than 800 deaths I certified myself. That included easily over 400 autopsies I performed myself, external examinations, death certificate, or medical record reviews. And at the same time, I also received brain consultations from people throughout the state and around the country, actually. And so I probably had over 100 brain consultations that came through. And so, yeah, you have a lot. When you stop and sit back and think about the different types of cases, it's a little daunting at times. It's not all of them are horrible. A lot of them are older individuals that die, quote unquote, sudden or unexpectedly, but have a background medical history that hasn't been attended to. But yeah, there are a lot of cases in that mix that are just horrible. I can't think of any other word, like pediatric abusive head trauma, kids who are murdered by parents or a caregiver. And those are the ones that probably weigh under the hardest.
And is it hard to not get numb, or is it?
No, I think I am numb, so it's hard to answer that question. Because I just think of the task at hand, right? I know, especially for pediatric abusive head trauma, I'll just say this right now. So the one thing that differentiates me, I think, the most other forensic neuropathologists is how lucky I was in terms of the training I received, right? Most neuropathologists have about 18 months. It's a 2-year fellowship, but 18 months are concentrated in learning about neuropathology. The other 6 months are reserved for research. But most people that go into neuropath training just learn about neuro-oncology. They spend a year looking at tumors or brain tumors that come in from the surgery department. And then they spend a few other months doing autopsy brains, assisting with the general pathology autopsies and autopsy brains. They do not have the opportunity to see many trauma brains unless they rotate through a medical examiner's office. But when I was at Penn, I trained at Penn, I had access to the Center for Neurodegenerative Disease Research, which is a world-renowned brain bank. So I was able to see all different types of adult neurodegenerative diseases. But I also rotated at the Children's Hospital of Philadelphia, and I had the opportunity to train under Dr. Lucy Rourke Adams, who is a pioneering pathologist. She's a pioneering physician, but she really helped develop the field of forensic neuropathology. And so I was able to sit through and learn from her over numerous cases that she received throughout her time, old cases as well as her current cases. And couple that to my background, I had about 10 years of concentrated research in spinal cord and brain injury, both the adult and developing brain. And so I knew that from a molecular, as well as cellular level up through the clinical level. So my background in brain trauma is probably far more advanced than most persons that you will meet in my area. And so with that, I've always felt that I've had some duty to take everything that she has given to me. Dr. Rourke, who I hold in such high regard, I feel that the knowledge and mentorship she's bestowed upon me, I have to carry and pass forward. So that's through the cases that I take on. And so I know how difficult these cases are in terms of being able to tease apart abusive trauma from non-accidental trauma. I also know that there's a whole generation of new students who are coming up that need to learn this material as well. So for me, it's really a gift that I've been placed in the situation and given all this great knowledge. And so I feel some sense of responsibility to these cases. So yes, although they are horrible, and when you stop and think about the details and what happened to this child, it's heartbreaking. But I know that, I have to do with this knowledge she's given me, work on this case. I have to somehow find justice or the answers for this child, for this family. So I think I focus on that aspect of it, and it makes it easier. I don't think about the emotional aspects.
Southwest Florida Frontline, live from the Sunshine State.
So Tom, speaking about neuropathology, spinal cord injuries, head trauma, especially in children,
Yeah.
I know that your son is an aspiring quarterback and you are his coach, and you
Yeah.
have been basically his whole life. So how does this go hand in hand?
Well, I think people always ask me that question. They say, how do you allow your son to play a sport like football, knowing all that you know about chronic traumatic encephalopathy or CTE? And I say it's because of the knowledge that I have that allows me to be there for him and allow him to continue playing this sport. And I'll say for several reasons. Number one, I think the benefit of sport or being involved on a team far outweighs the risks of potential injury. Because, for the vast majority of people who get injured playing sports, the injuries are like sprained ankles, maybe it's a break or a ligament tear. It's not severe head trauma, right? And so for him, I know that the benefit of being on a team and learning how to have accountability for yourself amongst your teammates, how to be a good teammate, a member of a group or a team, which so many of us are going to have to deal with as we go throughout our career. Me, myself, I know playing sports, I really give my time playing sports as a kid growing up. Being a part of a team helped me tremendously when I got to medical school and beyond. So for him, I knew there was that. The other thing, I think athletics, working out, training, you have to learn how to work towards a goal, right? You know that I need to get faster. I need to, my 40-yard sprint time has to improve. And so I'm going to put this work in, and you develop a workout program and you go daily. You're the one that goes out to the gym, out in the yard. You put the work in every single day, and you see yourself change over time, and you achieve your goal, and you realize what you accomplished. You realize, wow, I'm the one that put this work in, and by putting in this work, I was able to achieve my set goals. Well, that what you learn from there, leaves the field and goes into all aspects of your life. And I think it made him a better student. I think it's made him a better friend. I think it's given him more confidence to go after things that he may have been less confident or afraid of, because he's been able to see the success he's had on the field. And as a quarterback too, being the person who's the center of attention, I think it's really improved his confidence tremendously. So that being said, I think that's really important. On the other hand, with regards to football and CTE, there's this sensation that came out, I'd say about 10 years ago now, with the movie with Will Smith, right? Concussion, and that's centered around Dr. Amalu, who's an ME up in Pittsburgh, and he had some of the first cases of CTE diagnosed in former NFL players. And with that has been a lot of research and research dollars pouring into studying CTE. But it's not as if that was the first time CTE was ever diagnosed. We've known about chronic traumatic encephalopathy. It's gone through several different name changes over the past 100 years, but it used to be associated primarily with boxers. We call it, dementia pugilistica, so what we've really accomplished over this last, I'd say 20, 30 years of research into this is defining CTE, both clinically and pathologically. And the problem that comes with that is and Ann McKee's group in Boston is really the center in the world for studying CTE. There's a bit of selection bias that comes with that, in the sense that you have football players, professional football players, who will donate their brain towards science to get a diagnosis. And those are individuals who have symptoms of CTE. and are curious if they truly have the diagnosis. And so because they have the symptoms, they sign up and they donate their brain, and sure enough, they find out that they have CTE. But again, that selections bias skews our viewpoint or opinion of CTE, and we think that every person who plays football and who has had concussions will eventually develop CTE, and that's not the case. Prevalence is still, quite low. I'd say about 3% of the population. If you look at the community at large of individuals that grew up playing sport, because it isn't just football, right? We know that CTE has been found in persons who play other sports, soccer, baseball, motorsports, even people in the rodeo world. There's been a number of cases published. But again, the overall incidence of CTE is about the same in the population for other neurodegenerative diseases. What we know the difference with CTE is that you have to have had prior head trauma in order to develop it. That's the only requirement, right? And so what it seems as there's really a genetic predisposition that you have to have first in order to acquire CTE. So you have to have some genetic predisposition, and then of course have a history of repetitive subconcussive or concussive head trauma. And the interesting thing about that is that about 30% of people who have CTE also have other comorbid neurodegenerative diseases, Parkinson's disease, ALS, Alzheimer's. So it suggests that there's an inherited predisposition to develop these plaques or tangles, right? So that being said, getting back to where I'm at with Tommy is that, I don't know what his predispositions are. We're not at that point yet with CTE where we can predict who will or who won't get CTE. We're not quite sure of those biomarkers yet. So what I think you have to do as a parent is just be vigilant. So I coached on his team so I could be there on the sideline with him, and I could monitor him and look for injury, or if he had any concussive trauma, then you can make a decision, hey, do we pull him back now? Do we try to prevent him from getting further trauma? Because in these football players, if you look at the overall mortality of football players, it's still quite lower than the average population. I think the average age of death in professional football players is still, I want to say, late 50s, early 60s, and it's not because of head trauma. Most of these guys are dying of cardiovascular related illnesses, and that's more in tune with the fact that you have individuals that are required to be much larger than normal, for certain positions, and then after they get done playing football, if they don't maintain their sport or their exercise, that body weight that they continue carrying forward, they're used to eating a certain calorie level during their playing days. They stop playing football, and suddenly they continue that lifestyle without having the exercise to go with it. Weight gain occurs, and so does elevated blood pressure and all the complications that come with it. So, not to mention, a lot of these individuals who play sport develop osteoarthritis, they have knee issues, and they carry an increased burden of body inflammation, which can accelerate atherosclerosis and lead to cardiovascular mortality. So that's really the issue, is maintaining sport, maintaining physical fitness. And so I think by getting them in sports at a young age and preaching the importance of physical activity, not only can you give them a much more enriched life where they're better students, they're better friends, they're better eventual fathers and husbands, but you also give them knowledge about nutrition, knowledge about physical activity, and hopefully you also reduce the possibility of them acquiring cardiovascular disease at a later age as well. So for me, I think the benefit of sport for my son far outweighs any of the risks, and he's very happy because of it. I think almost all of his friends that he has now are his teammates. All of his great experiences have come from events on the game. We as a family have traveled to really cool places for his football camps. So yeah, no, and I think it's because of my awareness of what CTE is that I'm able to, keep him on this path.
So it's not that you are standing nervous on the sideline, knowing what can happen.
No,
sometimes I feel
still do.
having knowledge is a burden, or can be a burden, right? Because if you wouldn't know, you might have been more, I don't know.
I still do stand on the sideline nervously. It's worse now. because I don't help coach anymore with his high school team. So I just pace the field worrying about it. But it's funny, I worry more about his failure on the field. He's a quarterback. So unfortunately, when you play quarterback and, if you not just throw an interception, but if you aren't quite reading the defense appropriately, you're not making good reads, all the blame falls upon you. And so for me as a dad, oh my God, I worry so much about his failure or how he feels or whether or not he's feeling the barbs of the fans, mad at him because of a bad play. And so I worry about those things. And he's a tough kid. So thankfully, any little bumps and bruises he rebounds from very easily.
Southwest Florida Frontline, live from the Sunshine State.
And you shared with me on numerous occasions that your family really appreciates and likes living in Florida.
Yeah.
But, how is this, especially since you're a dad and you have to protect your children with all those hurricanes here? You probably went through quite a lot, right?
Yeah, it's funny. I think the first hurricane we had, the most recent one that hit you guys in Fort Myers, was that Irma? Yeah. So when I was there, we had Ian, and that was really that was a little bit of a scary one in the sense that we had to we left our house, we sheltered at a local elementary school with law enforcement and people from our office. It's funny, the lead up to the hurricane was a lot scarier than the actual hurricane itself. There's an eerie kind of calmness about the hurricane. The power goes out, you can hear the wind in the background. And then when you finally go out after the storm has passed and you see the damage, it's mind-blowing at times. And so for me, I think that the fear that came through the hurricane was really about my family. I was just concerned of their safety and the fallout of the hurricane. We were very fortunate, with Ian. We made it through fine, minor damage to our property, easily repairable. It's just the fear of every year when the hurricane season comes around. There's always an uneasiness, especially with my wife. She hates thinking about that. My kids hate the thought of losing power because, oh my God, no internet service, but we've been very fortunate so far. And that's when I was in Southwest Florida. Moving to Gainesville, we're more inland, so we didn't happen to have much trouble. And even in the Big Bend area here, for whatever reason, Tallahassee has not had many direct hits. They always seem to skirt either east or west of Tallahassee. So far, so good. But yeah, it's definitely not as fun as living through New Jersey winters, where you're more, the worst you have is a blizzard. I can handle that any day, but I do not like hurricane season. It's not fun for me.
I remember sitting actually in my guest bathroom trying to survive Ian, and had communication with the first responder community, the local one, that those rumors, came up that, thousands had called 911 trying to ask for help. They were in the attic, the water is rising. So what are a medical examiner's first thoughts after such a tremendous hit when you go back to work and you have to function? Do you, are you scared of the mind-blowing number of, potential fatalities? Or how do you function during those times?
Because of the weather service that we have now, you're well prepared for what the storm could potentially be in the days leading up to the storm. And so I think the first thing you have to do is really prepare yourself for all possibilities. And so great communication with your emergency operations center, law enforcement, have a plan in place for what you would do should there be a mass casualty situation. And I think in Florida, especially many of our medical examiner's offices, we're always close to either an airport or a major concert or stadium type venue. So the possibility always exists for a mass fatality event. So I think you have to have a plan in place first and foremost, regardless of whether it's a hurricane or any other mass fatality event. Knowing what you would do with regards to body storage, what resources you would use, in Florida, we have the FEMORS organization, which we can contact for assistance for those types of events that will help us with not only just simply storing bodies, but triaging the whole recovery operation, right? Staging a center for families to go to contact should they be trying to locate loved ones who are missing, or even just as simply as assigning a numbering system for all the victims and how you keep track of unidentified. So I think having a good mass fatality plan is the first and foremost thing we have to do. And then after that, you just, to me, it's remain stoic and just be prepared for any possibility and pray for, it to be nothing. And I'm sure you can attest that during the time at Fort Myers, at least, the vast majority of deaths were drowning deaths, due to the storm surge that hit that Fort Myers beach area. And that, unfortunately, the first day after, it's hard to get to most of those cases because the people who have to go in there have to go through all that debris first. And so first and foremost, it's a rescue mission. Who is there that's still alive that we can get to and save. And then afterwards, you go through trying to locate those, unfortunately, who didn't make it, many of which who are in various states of decomposition. So I think the first thing is just you prepare yourself both mentally as well as, strategically and logistically for handling it.
And then you also have those deaths that are probably kind of related, but just a matter of caused by, medical care not being available for people, who just have, not just, but who have a heart attack, for example, which can happen with or without a hurricane. But during a hurricane, worst case scenario. Yeah. So do you remember just approximately like the percentage of those cases versus the actual hurricane impacted death, or,
I think sometimes it's hard to put a number on the number of natural deaths. It's a very low percentage of those who died as a result of not being able to get medical care. Mm-hmm. I'd probably say for my time during Ian, maybe had a couple of deaths in that regard. But, there's a stress that goes into preparing for a hurricane and then also sort of repairing, your home or sort of recovering from a hurricane afterwards, because it's a physical, it's an emotional stress, number one. The anxiety that comes with it will certainly increase the activity of a person's sympathetic nervous system. So certainly you would expect all of us to have elevated blood pressure, elevated heart rate during this time period, which if you are already compensating for other underlying cardiovascular disease, would certainly make it a lot worse or lower the threshold for a sudden cardiac event, right? And if a person, and you'd like to think that everyone who has health conditions have prepared. In other words, they've made sure their medication is all in line, that they have a supply that would last them a period of several weeks. During my time in Southwest Florida, we didn't have a storm that sort of took out access to, major pharmacies or hospitals during my time there. And more importantly, even if a person was trapped, we're not talking about weeks where they were trapped and unable to access vital medications or healthcare. But, I think for me, the greater number of cases I received were those who I got, death calls for those who had cardiac events, had known history, but did not become medical examiner cases because, they were attended to by other physicians. So in other words, in our line of work, the medical examiner, I will take jurisdiction over a case if that patient hasn't seen their doctor in over a year's time, or if they died of non-natural cause. Someone who is well cared for by their physician and who dies of a heart attack around the time of a hurricane wouldn't necessarily become my case. But there's probably a lot of those patients that did have cardiac events due to the stress before or after a hurricane that may very well have been related to the hurricane, but didn't get counted as a hurricane death, because it didn't fall under our jurisdiction. But yeah, sure, it's a very stressful time. And you figure, as we say in our line of work, you take your victims as they come. we're always compensating for some underlying health condition. It's the question is what pushes us over the edge.
And then, imagine, or just imagining the number of suicides as a consequence from people losing everything. I mean, are they counted as
Sure.
hurricane related as well, or only if that was really written down in a suicide note, for example? Do you know that?
That is not counted as a direct death. So we had people who committed suicide and wrote in a note that they didn't want to wait it out for the storm, so they were going to kill themselves before the storm came through, and those aren't considered technically are not considered hurricane related deaths. Whereas let's say a person was driving to the store to get hurricane supplies, and they get in a car accident and they die, that's considered a hurricane-related death, But suicide, that's not something that we would count as a hurricane-related death. But sure, we always say it's the stress that, same thing with overdoses. Think about the number of people, who had idle hands and were at home, nothing to do. So, I'm gonna dose myself with fentanyl or whatever just to kind of pass the time, and they overdose.
But could you see like a peak in number of deaths not related or officially related to the hurricane, just as a subjective observation, or was it minimal?
Well, I'd say I can't recall a specific peak, but I do recall people who did commit suicide because of the hurricane, and they wrote it in their own notes. I do remember people at hurricane parties who overdosed. We had a house full of people, of 3 people who overdosed in one particular setting, who were having a hurricane party. So yeah, I think the problem there too is that, not only do you have the potential for overdose, but you have a limited ability then to help a person out if they are overdosing. Because once winds get to a certain speed, EMS can't travel to go help them. So yeah, there were a few of those cases, but not enough that I think would skew the data. But that goes for any major event, any major catastrophe that's occurring in the world, whether it be a war overseas or a major conflict, or an election result, or there will always be little spikes in people who commit suicide, people who commit violent acts, as well as drug overdoses and such.
Southwest Florida Frontline, live from the Sunshine State.
Speaking of spikes, we had a phenomenon a couple of years ago that literally changed the whole world forever. I mean, everyone was in the same ship. But just from a medical examiner's perspective, how bad was COVID really? Because I mean, we had mass panic. We heard about all those children cases, and I'm actually on call forensic anthropologist for mass disasters, and I got called to assist with the ME's office in New York. And the rumor was that they had so many cases of children who died due to COVID that they needed assistance, from external personnel. Can you perhaps share your firsthand experiences working as a medical examiner during the peak of the COVID-19 pandemic, starting in 2020?
Yeah, I think when it first broke and we first got wind of this virus that was spreading from China, Europe, and then coming over here, obviously, because every year we always worry about swine flu or a particular avian flu that has the ability to become more virulent and spread amongst human populations. And so it was scary from my perspective, because knowing full well the role of the medical examiner's office, that we were going to be the ones handling these cases, because obviously there is a major risk for public health. And so it's, our job to help in the diagnosis, the cataloging of these cases. And many times with autopsy, you help figure out what's the underlying pathology or what's the real driving pathology and deaths related to the virus. And so I knew that we would be, if you want to say, front lines with regards to the start of the pandemic. So the only fear that I had with that was because I remember us not really knowing what this virus was. I knew it was a coronavirus. And listen, 20% of all common colds that would circulate every year were due to coronaviruses. But we knew that there had been a couple previously, like SARS-1 and the MERS virus, the Middle East respiratory virus, that were pretty virulent, and even in healthy individuals could stimulate significant respiratory pathology, just because it would cause your immune system to go into hyperdrive, and lead to what we term ARDS, or acute respiratory distress syndrome. So when it was first coming over here, we didn't know what to expect. And so the question was, how virulent is this particular virus? And so we were tasked to certify all of the deaths, all the COVID deaths. And so the fear, the anxiety that I had was, okay, number one, how bad was it going to get? How truly contagious was this, and how serious was it in healthy individuals? And what risk that I put at my family and my mom and dad lived near me, were always over our house. My father, who has pretty bad COPD, I knew that any respiratory virus that I get prior to the COVID, I never wanted to be around him because I didn't want to give it to him. Because again, me being a pathologist, me being a forensic pathologist, I know that for general respiratory viruses, especially influenza, you have a significant increased risk for cardiac events in individuals with heart disease if they get sick. And so now, how much worse was it going to be with COVID? So I think those were the fears I had up front. And honestly, I'll say this, it was stressful, but I think more emotionally stressful than it was physically stressful, because I wasn't overrun with coronavirus cases. We had to certify these deaths, but most of those were medical record reviews, right? Because we were at the medical examiner's offices throughout Florida. Many of us were not actually bringing cases in and doing autopsies on them because of exposure risk, right? A person died in a hospital or died at home. They've already been diagnosed by, nasal swab with COVID. We know that COVID was their cause of death. We weren't going to transport them into our office, examine those patients, or do an autopsy and potentially expose everyone to virus. So for most of the cases, it added a little more paperwork to our desks, but it wasn't physically exhausting. It was just the anxiety associated with it, not really knowing what we were dealing with.
Sorry for interrupting you. I just had one thought. Do you think that during that time it would have been perhaps easy so that like a unnatural death slips or falls through the cracks because of how the procedure was handling cases that officially got declared as a COVID case by another physician or family members or?
Meaning someone erroneously called something COVID when it wasn't COVID?
Or the person had COVID but still was murdered or had, died to a different condition or a covered accident or.
Well, I mean, it's possible at any point in time for someone to get away with murder if it's not a traumatic cause of death, right? So obviously every death was still being attended to by whether law enforcement or emergency medical services. And so being able to identify trauma or homicidal trauma is still quite easy. It wasn't impeded by the presence of COVID. But, you can get away with murder by poisoning even nowadays without COVID, because if a person is, let's say, known to have underlying medical illness, known to be on tons of medications, a poison gets slipped to them by a family member, they die, someone calls and reports the death, law enforcement comes over to investigate. Oh, it looks like a natural death. This person's no evidence of foul play, no evidence of someone breaking into the home. All of this person's medications are in order. Look, they're found dead in their bed. I know that they have a history of severe heart disease, natural death, right? So therefore that case just goes to a funeral home and their physician signs a death certificate and the person gets away with murder, right? So those cases will always happen regardless of what's going on around us. I think, a lot more cases where COVID was given credit for a lot more deaths than would normally happen in a non-pandemic, environment. So, for instance, how many patients do I have all around me, or how many persons die every day of cardiac events in the setting of having respiratory syncytial virus or the common cold, right? Because, a person with COPD or a person with heart disease is compensating for their natural disease, and suddenly they get a respiratory virus that imparts a little more metabolic stress on their body. Their heart rate now goes up, and they can't handle the increased myocardial oxygen demand, and they die. The virus doesn't get any credit. That death gets certified as a cardiac death or what have you. So during the pandemic, I think there was more scrutiny on the contribution of the virus to death, and a lot more death certificates got assigned to diagnosis of COVID because, again, we were monitoring that. I think nowadays a lot more viral contribution to death is not really monitored because, how many people walk around with common colds and no one knows about it,
And, those safety protocols and measures that were put in place, in society, but also, specifically at your workplace, do you felt like this is really protecting you and your team from the virus, or, because you mentioned that you were scared infecting your family.
Sure. Well, listen, what really got to me during the pandemic was, I'm an evidence-based physician. I grew up, I trained as a scientist first and a physician second, and I always follow the evidence, right? And that's what we always should do. We make our decisions based upon the preponderance of the evidence. And what I realized early on in the pandemic, that we were being reactionary. We weren't making decisions based upon evidence. And so, for instance, even in the workplace, I remember when there were mandatory mask mandates and everyone had to suddenly wear these paper masks. And to me, I laughed at it because on the box of the mask that you were putting on, it clearly stated that these particular masks did not prevent the passage of pathogen back and forth through the mask, because the pore size of the mask wasn't meant to prevent viral particles or even bacterial particles from being moved through back and forth within aerosolized particles. The problem is that you had all these companies making masks without having any regulation to pore size. And so what potentially you were doing was making it worse, because now you had a person who was breathing in a paper mask and you were pushing an aerosolized droplet through a filter that was breaking a large droplet into many more finer droplets and now distributing them over a greater area. And so we were potentially doing more harm than good. On the other hand, I remember at work, and all of a sudden there was this, we got to put up these plastic barriers between everybody's desk. And I laughed and I said to myself, but you're disrupting the normal laminar flow of air. The way that buildings are constructed such that airflow is vented out of the building and circulates in a particular way. And now you're putting up all these barriers that are creating potential positive and negative vortexes and trapping air such that now you're potentially exposing persons more than you would before. And I laugh because, for a respiratory virus, if I'm breathing, the air that I breathe out isn't just hovering over my desk, it's traveling up and will go right over that 6-foot plastic barrier that you put against the person next to me. So we were doing more harm than good. And then there was also this rush to the vaccine, and that concerned me also. I got vaccinated early on because it was made available to us by the hospital because of our exposure. At that time, we didn't know anything about the severity of the virus, but we knew that we were going to be exposed, and then we potentially would go home and expose our children, our loved ones. And so we got the vaccination to prevent that. And we were sold a line that this vaccine would be, protective, and we were sold a line that the vaccine was safe. And hell, I've been vaccinated my whole life, right? So why would I think anything other than that? But then slowly we started to see cases of individuals who were developing clots in young individuals without any prior history of thrombophilia or predisposition to form clots, strokes in young individuals. And, we were starting to see sudden cardiac arrest in young individuals who were athletic and should not have had that kind of a dysrhythmia. And there was no pause. There was no, hey, let's stop for a second and figure out what's happening. It was, nope, we're going to go fast forward. Not only are we going to recommend that you get the vaccine, but we're going to recommend you get a booster. And after your second booster, you get a third one and the fourth one, without really trying to see, hey, what's the risk versus benefit cost of these mass vaccinations? Not to mention really studying, hey, listen, we're introducing, mRNA particles into our body that could potentially, in the case of coronavirus, produce about 1,000 times the number of spike protein that you would get from an actual infection. Well, what role is it having in our body? How long does that persist? What role is this having on our own innate immunity? And there never was a pause. And that's what I think really scared me as the pandemic went forward. And if you, as a physician, try to present or publish information that went against the common narrative, you put your career at risk, and that to me was the scariest part of the whole pandemic. It wasn't the virus. It was all of the things that happened around the virus.
Exactly. And like you said, I mean, it was officially voluntarily, but we all know that it wasn't. And especially in other countries. I mean, I'm from Germany and I couldn't fly back home seeing my family for years. Yeah. And I had to get the vaccine in order to be able to enter my home country again and finally see my family. And that was not only very scary, because if someone would have died during that time, I mean, I could not have, said goodbye or even go to a funeral. Sure. But it's also that at least they were extremely strict. So people really became depressed, over not being able to visit other people, not being able to visit, terminated family members in the hospital. They had to get vaccines because otherwise there was a lot of stigma or stigmatization. If you are not vaccinated, then you're basically a person of second class or an outsider of society. You're a potential murderer because you put everyone else on risk or at risk. People were forced to leave workplaces if they didn't get the vaccine. So I feel like it was so much more. So I feel like a lot of us didn't have a choice,
No, and it actually makes me
with the consequences, know.
And that makes me angry with hindsight. I fought to not have my kids vaccinated. And I've had many arguments in pediatricians' offices about this because, and I would tell them from what I see, and I've discussed this before, from 2020 to now, we've had more sudden cardiac deaths in young athletes than we've had in the 50 years prior to the advent of the vaccine. That alone should give us pause, right? Why is that? Why are we seeing that? And that never happened. It was, nope, we're going to keep pushing forward. And unfortunately right now, as more and more data is finally coming out, no one's being held accountable for this. And that's the thing that's really concerning. How do we prevent something like this from happening again if we don't have some accountability? I'm sure all of us we know people who right now have suffered because of it. I have a personal friend that had to get, had to start seeing a cardiologist because he developed a dysrhythmia in the setting of having a second vaccination. How long is that going to last? Is there scar tissue in this person's heart that puts them at risk for a sudden cardiac event during physical or strenuous activity? I don't know, but it's something that you have to think about now. Even like the whole ivermectin story. I remember when, people were jumping down the throat, calling other persons, crazy. You're taking horse dewormer. For me in the medical community, this is a Nobel Prize winning medication, that has worked wonders in, Africa, in terms of, its anti-parasitic effects, but more importantly, early models, when you're trying to modeling what medication would potentially be the most effective against this particular coronavirus based upon its efficacy with other coronaviruses. It was the hydroxychloroquine and the ivermectin. So, why would we just simply ignore that data? Oh, I know why. Because if you have a medication that's effective, then you get rid of the emergency use authorization for vaccination. More importantly, if you have a medication that's effective that doesn't cost anything, that a pharmaceutical company isn't making billions of dollars from, well, then we're obviously not going to promote that either, right? So, and that to me was the most unsettling part, because as a physician, that goes completely against your training. That first do no harm. The Hippocratic Oath. I mean, and that really kind of threw me off. Because suddenly, I had to change my whole way of thinking about how I treat patients. And for me, I don't treat the living patients, but for my friends who are in community medicine, it was a really difficult time for them because, they had to quietly talk to their patients and try to do off-label treatments because they were afraid of losing their insurance carriers. I mean, so it was a scary time. It really was.
Yeah, I feel like that would open a box of Pandora, but we could talk about the health system in general for probably for hours.
Oh, sure. Yeah. Yeah. But which is one of the reasons why I do what I do, right? Because I didn't want to be a part of that world, and thank goodness I'm not. Yeah.
It's just so mind-blowing that this was not just a phenomenon in one country. It was literally worldwide, and how this momentum even started and could go go so far that is it blows my mind. And now we have to pick up the pieces and unearth the mess that was created while putting our lives at risk. It's just
well, I hope we've learned that we will never let something like this happen again. And I don't think the people of the world would stand for that, especially given how much we've lost.
Yeah.
Southwest Florida Frontline, live from the Sunshine State.
Yeah, thank you for your opinion on that.
Oh, yeah, sure.
I want to come back to a topic that you touched earlier, brain injury, traumatic brain injury. I know that, you were part of, or you were called as an expert for testimony in a case that actually got worldwide attention, a case that played here in Cape Coral that we, both worked at while we worked at the same ME's office, the Wade Wilson case. Yeah. And, you explained a lot earlier about, traumatic brain injury and how this can impact or have a long-term impact on someone's health and decision-making. And to my understanding, that argument was used in the Wade Wilson case in order to get him off death row, if I am correct. Do you mind, sharing just a little bit what your role was, how what this case was about for anyone who might not have heard about it?
Yeah. I mean, all the details of the case are public, are well known. I mean, I didn't realize how worldwide it had become until I became involved with the testimony, because I was physically involved in the case when I was a medical examiner in that area. So I was one of the doctors who performed the autopsies on one of the victims. And so I was called in to testify because I was the physician who performed the autopsies on one of the victims. But I got called back as an expert in neuropathology for the sentencing phase of the trial, because the defense was trying to make the case that prior concussive trauma in Mr. Wilson led to him having brain damage that you could physically see on these imaging studies, and that was the cause of his underlying behavioral or actions. And I stepped in not to say that, hey, listen, whether child abuse or other exposures as a kid would cause a person to act a certain way. I'm not getting into the psychology of it. I was just there basically to refute the fact that the imaging studies did not show any evidence of what we call classic traumatic brain injury, right? So their brain injury tends to follow a particular topographical distribution, meaning that the areas of the brain that get injured in head trauma or from head impacts are the usual suspects, right? As the brain moves in the skull forward, backward, side to side, and it rotates around the central axis of our brainstem, the white matter tracts that travel from the top to the spinal cord, across our brain, into our cerebellum, are suspect for injury. And so there's a telltale pattern that we see when I'm looking at a brain myself, either with my hands or under a microscope, but also on imaging as well. And so basically what I, was just there to say that none of those typical patterns were present in these imaging studies. What the defense expert was trying to say about asymmetry in the brain was completely off base. That was an artifact of just how the head was positioned when the imaging was created. And so I was just there basically to, as I say, bring truth to the situation. You know what I mean? Rational thought to the case. But no, it was crazy to be a part of, because I remember when I had traveled to Fort Myers to testify. And I'm oblivious to, I don't have social media, I don't participate in a lot of those activities. So I didn't know what a media crazy thing this was going to be. And when I walk in there, there's like protesters all over the place, fans of Mr. Wilson who were, there against the death penalty, and those who were for the death penalty. And I was like, oh my goodness, I didn't realize what I was walking into. So it was definitely an interesting experience. Yeah. To add on to that, I'll just go off on a little bit of a tangent here. When you're in medical school and you're in forensic pathology training, no one prepares you for the courtroom, right? It's not you don't have a class in how to testify, or even during your training as a forensic pathologist, because you're only, training is for a year. The cases that you participate in never go to trial during that year that you're in training. They usually come up afterwards. So it's so hard to prepare yourself for what it's like to be officially deposed by a lawyer, or to actually have to sit on the stand and receive questioning from, generally, you're testifying for the state as a medical examiner, but the cross-examination, it's just an interesting experience. But more importantly, when you have these high-profile trials and you sit down in the courtroom, and for those of us who don't normally go on TV or aren't normally affiliated with media, and you have a camera, directly pointed at your head, and you're like, man, I tell you, your mouth gets dry so very fast. So it was an interesting experience. But by the time I had the Wade Wilson trial, it was very easy for me, because I had already been through a number of high-profile cases that were followed by national media, with media coverage and like Dateline NBC shows being made about the case. And so this is pretty easy for me. But I didn't realize what was disturbing to me was all of the fans for Mr. Wilson, because I get it, he had a pretty unusual set of facial tattoos, but I didn't realize how many people were like, fangirling and fanboying for him. It was a little disturbing, I thought.
And, coming back to what you said a little earlier, that you didn't get any training for that, and that this is intimidating, because also considering what is at stake, not only your career and your reputation, sure, but also you are kind of involved in a process that decides of someone's life, life sentence or even death row. And then, I can just imagine that, I would probably feel or get an imposter syndrome, like feeling as if all of a sudden, even though I have a PhD and I have this knowledge and experience, I'm a nobody. And
sure. And I think that's a lot of times what, and I'm not putting down the defense, but I think, when if you are a witness for the state, very oftentimes that's what the defense wants to have happen. They want to trip you up and have you get kind of lost in your own nervousness and not be able to effectively communicate to the jury. But I always say to at least medical examiners, You know your case better than anybody, right? You know that autopsy, you performed the autopsy, and that's all you're really getting on the stand to talk about is what you found, and the it's somewhat the interpretation of what you found. So it's pretty straightforward. Just maintain your lane and don't be afraid to say, sorry, I don't know. I don't have an answer to that. Don't feel like you have to answer every question or elaborate on every question that's asked of you, because many times they're hoping you do that and send you down a road that you're not comfortable with, so they can pounce upon you and tear apart your testimony, which previously was probably all 100% correct based upon your findings as they happened that day when you did the autopsy. So it's just getting comfortable with that. And again, it goes back to what I said earlier, is being able to relate to a jury, which for the most part are probably individuals that are not scientists or physicians. And so you're trying to explain to them physical findings or the meaning of the findings that you discovered at autopsy in a way that they'll understand. And that I think it's just trial and error. And I always recommend anybody that has to do that, go to court and one of your colleagues are testifying and sit in the courtroom and listen and get a better understanding of how this whole process works.
But even though you're only presenting objective evidence, which are facts, you are also a human being, and you have on a personal level, even though this should not cover or shadow your professionalism, but on a personal level, you have an opinion about what happened, to the victims. So how can you? Well, that probably goes back to what you said when we started, that you keep your emotions to yourself, because I cannot even imagine sitting just a couple of feet away from such a predator who did such a gruesome, murders.
Yeah, you have to not let yourself get triggered. You have to not, because again, going back to a good defense attorney will say things or try to lead you down a pathway that will jar those emotions and even make you sound argumentative, all of which is to discredit the information that you previously presented, even though it was 100% correct, let's say. It's just to sway the opinion of you as an expert. And so you just have to just keep your emotions in check, and try to answer the question as effective as possible. But yeah, it's a little, you could definitely feel the weight of the eyes of the person who's sitting over there in the witness area upon you. Because I've had to testify, actually the funny story is I had to testify I've testified in a number of cases, child abuse cases, given the nature of my work in neuropathology. And I happened to be testifying in a case of a guy, of a young child who was abused. And, the person was convicted of this eventually, but I mean, clear-cut abuse in terms of my neuropathology findings. That is, the severity of the injuries, the distribution of the injuries are consistent with abusive trauma, and not the story that was presented that this kid, fell while jumping on a trampoline and hit his head. So that being said, I testified to that effect, and the defendant, I remember I was testifying, and I can see the defendant out of the corner of his eye looking at me. And then he motioned over to the bailiff, and I caught my eye, so I looked over, and then he turned his head and he gave me this really weird stare that was a little unsettling. What I didn't realize is that he was about to have a seizure, and he fell off his chair and had a full-on generalized tonic-clonic seizure. And the judge turned to me and said, "Can you go over there and help him?" And I was like, "Am I allowed to?" Because I'm testifying against this guy, you know what I mean? And I know what this person did, but yeah. So I got up and went over there and I put him into, an appropriate position and just tried to prevent him from harming himself during this while we got EMS to come in. But yeah, that was a crazy experience,
Well, imagine him faking this and then attacking you so that you can testify. I mean, one thing I learned is everything is possible.
No, true. And I'm not trying to act like a typical, but I'm a big guy, you know what I mean? So I don't tend to worry about those things so much. He was a little dude anyway. So I kind of hope he wishes, he would have attacked me because I know what he did to that poor kid. No, but no, I was laughing at myself because, me being medical examiner humor, I'm thinking, well, I could just put my hand over. Yeah, don't worry, I'll take care of him for you, but again, those are the thoughts you have in the back of your mind because we're human, you know what I mean? And how could you not think, you certainly don't think good things of a person that does harm to children, at least I don't for that matter. But no, it's an interesting experience that one isn't truly prepared for until you actually get in that courtroom and have to do it, right? And so for me, I've been deposed so many times and had to testify so many times. I actually enjoy the process. I think it's fun, the sort of the argument, the banter back and forth, because I feel in my heart of hearts that, that there are people who have been wronged that deserve their justice. And so if I can present the evidence in just a purely scientific way without any bias, the truth will come out. And so I'm happy to do my part. And I think you have to practice at it to become effective at it,
No, I feel like as a medical examiner or everyone who works with you, you witness firsthand because the injuries speak for themselves. So you are the last and perhaps most important witness, for that and the voice for that person who died.
Yep.
No, it's just that, I feel that your job has so many facets, and I can imagine that a lot of people are probably good at the medical part or the forensic part, but not competitive speakers. So they might be easily intimidated. And you need the whole package, needs to be.
I think there has to be, I think during your training, the only way really to prepare yourself for that is to make the resident or fellows do more public speaking, whether it be presentation of the research or presenting case reports. For instance, I forced myself to lecture, whether it was, I participated in medical school programs where I lectured to undergraduate students about scientific topics, persons who were interested in medicine, knowing full well that I would be talking to them and their parents and giving a lecture about a complicated scientific topic. At that time, it was stem cell, research, but having to try to explain it in a way that was not too scientific. And I knew that this was only going to make me better at public speaking. And so I had to put myself in uncomfortable situations because that was the only way for me to get better at it. And so I tell every person, every medical student, and whether you're going into forensics or you're going into clinical medicine, if you're in clinical medicine, you're going to be having many meetings with families, discussing your findings, discussing a person's care, and you're going to have to get really good at speaking to others. And so I think the more practice you have, the better you get.
But I feel like it's one thing talking to family members, for example, because that needs compassion. And I feel like that is something you tune into your heart and you just, naturally tune into this. But this competitive speaking in court, for example, I just remember, I did my PhD at a medical school in Germany, even though I'm a biologist. But and it was terrible because they would constantly intimidate you and hold you. They didn't want you to grow. They didn't want you to think outside the box. You would get punished for speaking up. And this is why, and I know you are different too, but, me now being a professor, I want to foster an environment where my students feel safe to go in their thoughts and follow, a thought and voice it, even if it's wrong, because you need to be confident in trusting your thoughts. And that is, in my opinion, what is important, especially in your line of work. You have to be confident and trusting your experience, your thoughts, your knowledge.
I think all of us in medical school, we experienced that with our attendings. In other words, there were a lot of attendings who would behave in that manner. That is, would purposely ask you questions. They call it pimping you. In other words, putting you on the spot, asking you difficult questions. And when you did not know the answer, making you look a fool in front of everybody around you. Exactly. And, a person like me, my personality, I'm like, okay, all right, I see where you are, bring it on. It would force me to go home and then prepare myself even more so then the next day I can come in and come back at them, right? Whereas I know I've had other friends where it just completely destroyed their confidence, right? It destroyed their self-confidence in themselves and had the opposite effect where it made them feel like they couldn't do this work anymore and that their self-doubt creeped in and became greater. And that's not the kind of environment I think that's conducive to learning. I think whenever you have anxiety and you raise your heart rate, your ability to learn, decreases. And I appreciate the Socratic method. I employ that when I'm here with my students because I want them to be involved and I want to ask them questions. But I always tell them that old saying, the dumbest question is the one you never ask, right? And that there are no wrong answers, right? We'll work through every wrong answer because I don't know why you thought your answer was correct, but I want to know how your brain was thinking about it because part of that process is important, right? You know what I mean? And so we'll help you arrive at the right answer. And when you get to the right answer, now you will remember it, but you will also have confidence to ask the question again, right? And so that's the kind of environment that I like to create. But you're right. When you have individuals that are like that, I think it negatively affects the learning process. And I used to hate those people. And but I felt it was my challenge to fight them. I hate bullies, right? And if I find a bully, I want to challenge a bully because to me, I think there's no place for them in society. But I would say in some weird way, it's funny. I just had to talk with my cousin about this last night. She's in residency right now. She wants to be a forensic pathologist. And she has an attending that,
So it runs in the family.
Yeah. Well, I'm happy I convinced her to go into this, and because we need good forensic pathologists. We are so in need. But she had an attending who, older guy during brain dissection of all things, right? Would ask residents really, try to identify, white matter tracks that a resident would not even have knowledge of unless you are a neuroanatomist, right? But to me, it's almost like working out their own insecurities. Like, look how smart I am while I belittle you. And I just was telling her, I said, listen, do what I used to do. It would get me angry, and make me work harder while not losing my confidence. It's a hard thing to do, right? Not lose your confidence, right? But be challenged, right? Think of it as a challenge, right? You're not going to beat me. You're not better than me, right? You have to have a little of that cockiness, I think, to survive, because if not, you'll get eaten up. And those individuals, the only way to beat them is to just push back, right? Because, in my opinion, they're insecure to begin with. So the second you throw some knowledge on them, they may back off a little bit because they're like, oh, now this person could potentially make me look foolish, so I'm going to back off, right? So I don't know. It's hard to navigate that, but I think the problem is that you don't want that feeling you get from that one person to permeate other areas of your learning, right? Now every attending you work with, you're going to be a little more mousy and afraid to answer, afraid to ask questions because you don't want to look foolish, and then you hinder your own progress, So I was just trying to, get in my cousin's ear and be like, listen, don't worry, I'll take care of that guy.
Yeah, and you can't be the voice of the people on your autopsy table if you're afraid of getting bullied. Because I know from my own experience, and this is why that specific topic is so dear to my heart. It can be very toxic working in the forensic field. I mean, you go to you go to the death scenes, and then it's your jurisdiction, and you have to stand up for yourself, and especially for that person there on the floor that you need to be the voice of, and then you have law enforcement around you, and they are testing you, they are testing the boundaries, and like you said, it's better you try to see it as a game. And instead of being intimidated or even taking it too personal and feeling aggravated or anything. But having said this, what do you think? Why this line of work creates so many unhealthy workplaces? I know this is a judgment, but
no, it's a good question. There's probably a lot of reasons why. I mean, first and foremost, any high stress type of line of work, I think engenders those types of situations, right? Because people that do not know how to handle their own inner stress, inner emotions may project that upon somebody else, or project their fear or anger emotions onto others. And so I think that may be a small part of it. Also, I think the personality types that are drawn to these types of professions, in medicine, you have a lot of those types of type A personalities that unfortunately, the old school way of thinking when it was a much more male dominated field was the paternalistic way of thinking. Like, I have all the answers. You have to listen to me and follow what I say. You know what I mean? I'm the male, and that has changed today because medicine has a lot more women in it, but that paternalistic type mentality still exists regardless of your sex or gender.
It's still a boys club,
Yeah. And a lot of areas it is, you're right. Forensics, I mean, thankfully we're seeing a lot more female voices and female leaders come into the profession. But I think in any kind of high stress position like that, you're going to have those personalities. And let's face it, I mean, especially from law enforcement, I mean, their life is always in the line, if you will, right? Before that person was dead, somebody shot that person. So there was a situation that they potentially would run into and put their lives in the line. And then after that person is dead and their body gets transported to my office, they have to go back out there, hit the street and investigate that case, right? So I can appreciate why maybe they lower patience or, have a little more aggression in how they handle things.
But, sorry for interrupting again.
Yeah, no.
I know I mentioned this as an example, but I actually respected my law enforcement coworkers way more because it was easy. Once you stand up for yourself, it's a done deal and you're part of the team. But I feel like, the people who actually work on maybe the ones with I don't know how I can say this without,
No.
I feel
I understand what you're saying. In other words, yes, I certainly know that within law enforcement, they do test you, right? They want to see what kind of person, what you're made out of. And once they realize that, okay, yeah, I can trust this person, then it all evaporates and you guys work well together. But within the medical examiner world, it's interesting. I wonder if it's just personality types because, a lot of your medical examiners, pathologists don't have a lot of interaction with other persons, right? They kind of work behind the scenes. They're in the basement or in the morgue, or they don't have to have a really a sociable personality. And so I don't think their interpersonal skills are just lacking, right? Their inability to understand the emotions of others around them. And maybe that's why they're good at being a forensic pathologist, because they have no emotion. They can turn off their emotion and handle the material that we handle, seeing death all the time, but their ability to relate to another person and the work stressors and what you're going through as a person in the moment is gone. I have no idea, but I do find that a lot in our profession, and there's a high turnover rate in a lot of offices in those other positions because of that. So you hope that that better leaders get pulled into the fray. As time goes on,
Yeah, I feel like it's so easy to blame the type of work when people leave an office, for example. It's like, oh yeah, they couldn't handle the cases or they couldn't handle death on a daily basis. But I feel like everyone I spoke to on a personal level, it's not that. They are passionate about the job. It's more like the workspace or the workplace in general is very demanding in a toxic way, and
I think that's a good lesson for anyone who's going into any field, but especially if you are, we're talking about forensics. So if you're a young student, it's important to try to never lose that passion, because it's very easy for a workplace or even a personality type to beat that passion out of you, because suddenly you get into a work environment and your hard work, your work ethic are not respected. There's toxicity, and suddenly you find yourself becoming depressed, unhappy, and you start hating the work that you once loved. And I always say, when that happens, pull yourself out of that as best as you can and try to find another place to go work, because you don't want to lose that passion, because we have to work many years of our life. And I think this field is so rewarding and so in need of good persons that we'd hate to lose someone because of that reason. And I always say, not every place you work, not every environment is going to fit you or your personality. So for instance, not even talking about toxicity, but in terms of work volume and types of cases, right? Maybe a big city office suits you, right? Maybe you like living in or around a city, but the types of cases that you get in a large city, a lot of gunshot wound homicides and traffics and those types of things suit you, whereas other persons maybe like working in a smaller community setting where the variety of cases is different. You have to find your speed and where your personality fits. And all I can say is, if you're in one place and it's not working, don't all of a sudden give up on your dreams or what you once loved. Go find another place to practice that. So therefore you can find that love and that passion again, because you're going to need to rely on that to carry you forward through those tough times.
These were amazing, supportive pep talk words to round up this interview. But last but not least, I still want to ask you just a few more questions.
Yeah, sure.
So is there any opportunity that you regret not having taken?
Oh man.
Or any situation, anything that where you are like, oh, I wish I would have.
It's funny, I think of myself as being very thankful to have found this career, because again, as I said in the beginning, I didn't think I was heading down this path. I kind of, I didn't know it, but all of my background training was leading me to this point, and I think worked out very well for me in my career. So I'm very thankful for that. I think I wish I would have had more of an academic approach. In other words, there's a lot of things I still want to accomplish. I think I need to accomplish, like from a brain perspective, right? One of the things I've always been very passionate about is pediatric abusive head trauma, and being able to tease apart the differences, susceptibilities, regional susceptibilities in the brain of a developing child, which is vastly different from a 1-month-old to a 3-month-old to a 6-month-old child, and how that brain responds to trauma. But also being able to tease apart accidental trauma from non-accidental trauma. So I think being able to develop a brain repository or bank, a tissue bank, will be beneficial for that, with other medical examiners' offices to collect that tissue and systematically, tease apart those vulnerabilities. And being in an academic setting, I would have had more time for that. I would have had more opportunities for that. There's still a lot of things I wish I would have written that I haven't written, case report wise and presentations, but I took my family first. And so those are the regrets I wish I would have had earlier in my career. I would have done more of that. But now as I'm getting older and my kids don't need me as much anymore, I have more time for that. So I will revisit that, but I can't, I think, in terms of career, I always say that, mistakes are important, right? Because that's how you really learn. We learn from our mistakes. And career choices I've made, places I've worked that didn't work out, or I wish I would have been somewhere else, I don't regret, because it helped me find where I am now much easier. In other words, it helped me get to where I am now, know what I'm willing to accept, what I'm willing not to accept, how I want to structure my future much better. So no, I think all of those bruises that we get as we go through our career are important. So yeah, I can't think of one thing that I would have changed, other than I wish I would have been involved more academically.
Southwest Florida Frontline, live from the Sunshine State.
So I now want to come to our category, you can't make this stuff up. I actually learned this while working with you and under you. So what is your most unbelievable or strange case, the one that stood out, the one that was perhaps most gruesome? Is there any case that in particular where you would say that case fits into this category?
I'll tell you this. I mean, we've seen it all, right? I mean, throughout our career, we've seen crazy and incredible things that we think would never, ever happen. And I know you've been involved in it. Like, you've had like the people that have horrible homicides, how, decapitations, you name it. I mean, we've seen it. And so it's hard to pick one particular thing. There are things that stand out in my mind, as like crazy experiences. And I still remember them fondly too. Like, cause I think for me was probably back during my time in Miami when I went through training, because I've never experienced anything like this before. Right. So, I go through medical school. I've never been to a crime scene before. I've never had to do anything like, anything remotely like this before. So I remember my first crime scene I ever had to go to, which was a crazy crime scene for me, was because it was at an apartment in Miami. And number one, I had to figure out how the hell to get there, because driving around Miami, it's like taking your life into your own hands. I mean, it gets pretty crazy.
Yes.
But me showing up on scene, my little trusty little camera, the area is cordoned off by law enforcement. I got to try to get in there and show them my little badge and say, I'm supposed to be here, let me in. And you get in, and it's just like you see it in the movies in terms of, the evidence tape is all lined out. They have, crime scene is around, they have the area staged. And I remember this particular case was a guy that had gotten a prostitute, and she came over, and apparently he had held her captive, wouldn't let her leave, and her pimp showed up on scene with a couple of other girls and tried to gain access to the guy's apartment. I remember like he had gone around to a window and tried to get into the window, and the guy had a gun and started firing at the pimp from inside the apartment to the window. So that's when the pimp called the police. Police came. There was a bit of a standoff. And then they heard, a few pops. And of course, they then rushed in and found him dead. But the prostitute was also killed. And so, I get called out to the scene because, in Florida, the body is our jurisdiction. So law enforcement can't touch the body. It's our jurisdiction. So we sometimes would have to get there on scene to help out if we had to move a body for them to get at evidence, or to try to, gain access to clothing, or so on and so forth. And so for me and my little inexperienced self, I remember showing up and, that the whole place had been ransacked by the guy. So there was just debris everywhere. Law enforcement had been in there. That they actually had fired tear gas canisters, and so those were still present in there. And I remember going in and seeing the victim, and I still remember her. She was wearing a white and black dress that was completely covered in blood. She was laying on the floor, sort of like if the wall, it was a room. Her head was in the corner of the wall on the floor, propped up like this, and she had a huge like hunting knife sticking completely through her neck, and I could see blood everywhere, cast off everywhere, multiple stab wounds, and it was just like, wow, like what did I get myself into? I mean, it was the first crime scene I'd ever been to, so that will always stand out to me. And I remember in the back room, I could see where he was. He had shot himself in the head. He fell back on the bed. So there was those two bodies. And that's when it started. It was like, all right, hey, let's go, and I had a multitude of really interesting scenes after that. For me, it was like, wow, it's my first, stab wound homicide, learning how to, identify different types of stab wounds and trying to understand the instrumentation that comes with it. Obtaining evidence from a stab wound, like retrieving a bone that you can then hand a crime scene that they can actually create a mold out of and compare that to the actual, murder weapon, and then, and look at patterns on the knife versus patterns in bone. Really cool stuff that I had never learned about, because in medical school, you learn about medicine, right? And how to diagnose disease. So this was my first experience of this. So it was really cool. Miami was a crazy place. We had over 350 homicides that year. I had numerous homicides. I mean, I had cases of guys that were shot like 65 times in a drive-by shooting, with bullets everywhere, versus, crazy domestic violence cases. you name it. I remember our first day on scene, there was a guy who had, he apparently had a psychotic break, was arguing with a person in his apartment complex, shot that person, then left the apartment complex, went to the balcony of the apartment complex, shot across the street and killed a couple people across the street, went back in and went to several other apartments, killing different people. So you see just unbelievably horrible things, and you have to get over the fact that you're seeing horrible things. Get that out of your mind and look at the evidence and try to see what you're supposed to be seeing, which is, what is on the body here? What evidence is this body presenting to me so I can better understand how this person died, what took place leading up to that death, and how I can get that information to law enforcement so they can use that to help put together their scene, and better understanding, what happened on scene and how to go about finding the person who committed that act. So I think that once the initial shock is over and you get that out of your system, then it's time to go to work. And I just remember that time as being a crazy year because, moving my family out of New Jersey, getting to Miami, having to navigate Miami, but then also seeing things I've never experienced before in my life. And you get pretty experienced pretty fast. And ever since then, every year I have crazy cases that, would make you shudder. But to me, the most interesting cases are still the natural cases, the cases that are a true medical mystery that requires me to draw upon all areas of my medical training to find the answer. Those I think are also most satisfying, especially because you can, in terms of the closure you can give the families when you figure something out, and in some cases actually provide knowledge for other family members of an underlying genetic abnormality that they weren't aware existed amongst them as well. So even though this person died, you can still somehow help the living. But yeah, I've had a number of those crazy cases. From a brain perspective, I've had a couple cases. I remember adult and pediatric kids where we thought it was trauma, and it turned out to be a tumor, a previously undiagnosed tumor. And so, you have a law enforcement investigating. You have people who are potentially going to be arrested or be sued for wrongful or wrongdoing when you find out that, their story was true. What was really the driving force behind this person's death was a natural process. So those cases are very satisfying, and probably stick out in my mind too as some of my, if you can call them, more favorite cases.
But in reference to those crazy cases where people do crazy things to each other or even sometimes to themselves. I mean, we have seen that too, things that are actually unbelievable. I mean, on a professional level, yes, we only collect evidence and we only try to find objective evidence, that helps to find out what happened there and to make a case. But on a personal level, I always found myself asking myself, why? What were you thinking when you did this? Why didn't you stop? It's think about people who strangle others. I mean, that takes time. The usual mechanism should be at some point, even if you are black out or whatever, that you come back into consciousness and you stop. And those people do not stop, and they do even more. And that is, from a psychological point of view, always also very interesting to find out what was going on there and why, the big why behind it.
Yeah. I think how people process emotion is interesting. I think the antisocial personality disorder, person with that sort of sociopathic tendencies is interesting because where you and I have normal human empathy and are introspective and can think about how others feel, there are individuals out there that just do not have that, and do not have a change in heart rate at all when they see or are a part of something, very stressful or like a homicide case. How to me, I mean, seeing someone get killed in front of me or around me would certainly get my heart rate up, get my emotions, all in a tizzy. And I think it's so to me, I think, from a biological perspective, I find those individuals interesting, and they're interesting to study too. And there's a lot of them in the community all around us, variations of that. So, it's amazing when we stop and think about what others, the horrible things that persons can do to each other,
One last question, Tom. Considering all those crazy cases down here in Florida, and that probably gave birth to these social media memes, is there such a thing as Florida Man?
Yeah, I think there is. I think, but it's an amalgam of stories. I mean, the best stories come out of Florida, and I don't know why that is. I think we truly are a melting pot of persons from all over the world, right? Florida, collects people from everywhere. So that's one reason, I think, right? And I think a warm place is it attracts crazy people, right? I mean, it's.
I don't know. I've lived in Hawaii and it was pretty chilled, actually. And
I think it's hard to get to. Hawaii is hard to get to, but there's so many interstates that run right into Florida, right? So maybe that has something to do with it. I have no idea. A lot of tourism, so people are a lot of prey for these crazy predators to prey upon. But yeah, it makes it interesting. I think no matter where you work in Florida, you're going to find very interesting cases.
Exactly.
I rather enjoy the Florida Man cases. It makes my life amusing.
Yeah, thank you so very much. That was amazing, very informative.
Oh,
and
my pleasure.
For sharing all this with our audience.
I thank you for having me. I think it's a great format, especially I'll just say this, in my line of work, there's probably about 750 of us in the country. We need probably more than double that just to really handle the case volume that's existing all across this land. So I really hope that more shows like this, or even through television and social media, that people learn about the career of forensic pathology, even those who are in medical school already and who perhaps weren't even thinking about pathology. It's such a rewarding and fun career. I think the great part about it right now is because of the demand, you can find a job almost anywhere in the country. So therefore, you have your pick of where you want to live, what type of environment you want to work in, whether it be rural, whether it be more suburban versus urban. And again, never a dull moment in my life, in terms of the interesting cases I see. So I hope that if anyone is ever interested in this, you can always reach out to me. I'm here at the District 2 Medical Examiner's office. Very easy to find my email online or our office. We have students who come through here and shadow routinely. I think the only way you can truly understand about a profession is to get that visceral experience and see if this is for you. I'm glad you have this venue and this audience, and people, please keep thinking about forensics and reach out to me if you ever want to have that experience.
Thank you. And we will put the contact information of your office in the show notes so that
great. Thank you very much.
Is there anything else that you would like to say to future forensic people, forensic scientists or pathologists or crime scene techs or
I can't think of anything specifically other than, I think, just to go back to things that we talked about, maintain your passion, right? Any job, I think, are going to have moments where it gets tough. There are periods that we can't control, like we talked about earlier. This has been a crazy month, and this will be a crazy season for me, as it always is. But it's not emblematic of how my everyday is if you average it across a year. I've had far more rewarding days than I've had stressful days. So just stick with it. Don't forget what got you into this field in the first place. Just keep at it, because we really need all of you. We truly do.
And I want to add, never stop believing in yourself, and don't let other people tell who you are.
Very true.
That's completely up to you. And
well said.
Thank you, Tom.
Well, a pleasure. It was great speaking with you as well. So,
bye.
Bye-bye.
Your story matters. Reach out to us at swflfrontline@gmail.com. Follow us on Instagram, YouTube, Spotify, Apple Podcasts, and Amazon Music under @SWFL Frontline.